Okay, so I have something really special that I wanted to be able to share with everybody. This is an open invitation to anybody and everybody willing to engage, critically engage in this discussion, conversation. I guess we could center it around diabetes. I just finished a diabetes program in one community. It was probably about the sixth one that we've done this past year. It's my favorite 4-part series. It's all done virtually. Lots of really, really meaningful discussion come about from these engagements. I'm obsessed. And I feel like I'm not going to stop until diabetes is dead. I'm possessed, absolutely obsessed over it. This discussion that I wanted to invite anybody and everybody into is about exactly that. In our diabetes program, in the first session, we eliminate diabetes with dietary or nutritional interventions, and as well as exercise. I bring in one of my exercise physiologist friends who doesn't call herself an exercise physiologist, but she definitely is. She focuses on injury prevention and delivers a really incredible presentation on the weaponization of exercise as a means to be able to treat and prevent diabetes. I focus on the nutritional components, of which are very simple. If you remove the carbohydrates, you remove the diabetes. It's over. You never have to think about it again for the rest of your life. By the next day, it's gone. And for participants who are engaged in these virtual programs, when they adhere to the protocol, the next day, their diabetes is gone. And a lot of people have gone almost 2 years now without ever having to think about diabetes ever again. And so this approach is a realization that we are biologically obligate hypercarnivore species, and we're designed to derive all of the nutrition that we require from the meat and fat of animals exclusively. So I wanted to create an open invitation to record and release conversations with myself and healthcare professionals who are working in Indigenous communities to critically engage in the knowledge presented here. I want to be able to share these conversations. They're one of the most meaningful things. This is one of the most meaningful things that I've ever done in my entire life. And I think that when it comes to my opportunity to maximizing, or my responsibility to maximizing my impact, to utilize the tools that I've been given and that I have earned in the best possible way, this is something that I have to do. I have to meet with, record and release authentic, critically engaging discussions with healthcare professionals or academics or anybody who has something meaningful to offer to the idea of utilizing an obligate hypercarnivorous diet as an appropriate intervention to alleviating Indigenous communities and communities across Canada and the United States and anywhere of diabetes, metabolic disease, obesity, and all of the other chronic diseases associated with that, and even outside of that, autoimmune diseases, accelerated aging processes. These are all things that are really, really, where a carnivorous diet is appropriately indicated as a valid opportunity to achieve healing. These are really, really powerful and beneficial discussions. And so here's my open invitation. If you are a health center, if you are a healthcare professional working in an Indigenous health center, let's talk about a culturally appropriate care plan, a culturally appropriate care protocol for diabetes, a chronic engagement in a obligate hypercarnivorous diet as a means to be able to alleviate, treat, prevent diabetes in Indigenous communities. I think this is something that we are responsible for. If you're working in an Indigenous community and you're responsible for teaching about nutritional protocols as an appropriate intervention for diabetes, this can and should be a consideration. If you wanted to learn more, let's have a conversation about it. If you don't agree with anything that I'm saying, let's have a conversation about it. If this is something that the opportunity to eliminate diabetes tomorrow in every single one of our clientele and every single one of the patients that we deal with is a tremendous opportunity. And it's sad that it is not recognized as such. And so I just wanted to create a call out, an opportunity, a place and a space to discuss, chat, and critically engage with the knowledge presented here. You remove the carbohydrates, you remove the diabetes. We are responsible for this information. And so let's have a conversation about it, record and release, and let's work together to eliminate diabetes in Indigenous communities.